Courtney.
Hi everyone.
This is my older sister, and we are here to talk to you guys about our miscarriage history, our struggles that we've had, some of the disorders that Courtney has and that we both have together, but she has a few more things going on than I do. So we are going to go through and basically talk to you about the struggles that we've had. So collectively, you have had, this is her, she's got a baby belly going on. She is going to deliver on Wednesday. So today is
C-section Wednesday. I'm so ready.
Yep, today is Saturday, so C-section is scheduled for this coming Wednesday. Courtney, her first delivery that she had was an emergency C-section after trying to push for a few hours, and so that's why she has to go back and do another scheduled C-section because they don't want her going into labor at all. But collectively together, between her and I, we've had, what, 14 pregnancies? You've had 10.
This is my 10th pregnancy, and I only have
one living birth.
Daughter, one living birth. She's 8.
Yes.
Almost 9.
Yes, and then I've had 4 pregnancies, 2 miscarriages, 2 live births. So collectively together, between the two sisters, we've been pregnant 14 times, but she's carried the brunt of it. To start off, to give you kind of general information about what we have going on that causes most of our miscarriages is a genetic, it's a genetic mutation called MTHFR, and I'll link the words right down here below us to show you that long word of what all of that means. So it's MTHFR. So basically, it's a gene mutation that leads to high levels of your homocysteine level and then low levels of folate and essential vitamins to create a healthy pregnancy and sustain it. So basically, with the MTHFR, I have 2 copies of the gene, so I am homozygous. And so the only time my levels are out of whack is during pregnancy, my homocysteine levels. And then with Courtney, she is heterozygous, so she has 1 mutated gene of that, but she also has other stuff going on as well. So I'll let you tell those.
Okay. I have some of it written down here, so I'm going to bring that up.
Yeah, we've got, if you see me looking over here too, it's because I've got my computer going on so we can give you kind of more facts about it. And if you guys search MTHFR, there's so many articles and there's so much more written about it now, but back when we first became pregnant, it was almost unheard of.
Yeah, it was very rare, and a lot of the doctors, most doctors assumed that all we needed was the extra vitamins that our body would not didn't make. So they just thought we needed extra vitamins.
Which for pregnancy wise, that was my issue. That's all I needed was the extra vitamins. So all I needed throughout my pregnancies was aspirin, extra folic acid, and I had to take vaginal progesterone throughout my first trimester, and then I weaned off of that. So I'm going to let Courtney talk all about her stuff that she has going on too. Yeah. I'm homozygous C677T, and Courtney is heterozygous
A1298C, which is actually rare. Usually the most common thing you see with MTHFR, the gene that's usually mutated is the gene that Caitlin has. So mine is actually it's rare, for the gene that's mutated on me.
So Courtney, like she said, her gene mutation that she has, even though she has 1 copy of it, her gene mutation is more rare than mine being more common, and I have the 2 genes.
And mine, pretty much what they have come to find out is that it causes me to get, it doesn't seem to affect me at all unless I'm pregnant. In your placenta, most of the blood vessels in your placenta are made up of capillaries, and that's the smallest blood vessels in your body. And mine will start to form clots. So I have all of my pregnancies, they start out normal. They start out, everything's growing on track. There's a heartbeat. Everything is fine. And then one day it all just stops. And that's because I formed blood clots in my placenta. So, like, I have to be on top of the fact that as soon as I get a positive pregnancy test, I have to be put on blood thinners.
To start thinning.
So I take Lovenox to thin my blood.
Which are the injections that she puts in her belly.
Yep, once a night. The whole time I'm pregnant up until a few days before I have the baby. It was actually, my husband was military, and I happened to, just by the grace of God, find a doctor right off post that...
And who knew about the disorder and was so helpful.
Yeah, really, to be honest, the best way to describe it is I was in their doctor's office group was doing a study, and at that point I was so desperate to figure out what was wrong and have my daughter.
At that point, did you have miscarriages yet?
I had already had 3.
3 then.
Nevaeh was my fourth pregnancy. The doctor even told me, me putting you on this, other doctors are going to think I'm crazy because this isn't what they normally do for your disorder. But pretty much at that point, I was a guinea pig, but I didn't really care.
But she was right. She was desperate at that point.
Yeah.
I mean, suffering that much loss before you actually had a live birth.
I was just determined to have one, no matter how unconventional it was.
Right.
So the series that they ran on me of blood tests to find out that I had the MTHFR was actually a whole bunch of tests that they run on stroke patients. I guess maybe to find blood clots. Not really sure.
A lot of the causes of stroke is due to that ischemic blood vessels, so you're not enough blood supply.
I'll never forget it. It was like 17 vials of blood. I was pretty
traumatized.
Yeah. I was a guinea pig, but I didn't care. I let him do I did whatever he told me I needed to do, and I was on the shots the whole time. I actually have all the meds written down.
The cool thing about our mom is that she's so involved with us and our pregnancies that from the second we had positive pregnancy tests, our mom created blog sites, and I will link those down below in the description so you guys can look back and see every positive pregnancy test that we had, every test that they ran on us, monthly updates on our pregnancy. So I'll link all of that below because all of the information that Courtney will be talking about is on these blog sites, and all of this information came from those doctors who helped us have normal pregnancies and deliveries. So.
My doctor, before the one I found to help me carry Nevaeh, he actually had me on pre-pregnancy meds. And that was progesterone 3 times a day, low-dose aspirin, 81 milligram, prenatal vitamins, and he did not put me on the extra folic acid because he did not feel at that point that was what I needed. He thought it was the blood thinners problem.
Right. And then me, on the other hand, I had all of that she just said, but then I did have the extra folic acid, and that's all I took.
Pre-pregnancy?
Not pre-pregnancy, at the very beginning of my pregnancy. So when I first found out that I was pregnant, that's what I started.
And then a DHA supplement. So those were all my pre-pregnancy
medications.
And then what he would have me do for a couple months, it was like this, to where I took all of these medicines, and then I would, at a certain point, I would take, he'd have me take a pregnancy test, and then if I was not pregnant, which was a couple months worth, I would stop the progesterone to let my body do what it needed to do to have a normal period, and then he'd put me back on the progesterone 3 times a day, and then once I got my positive pregnancy test with Nevaeh, I continued to stay on those medicines. And then they added my post-pregnancy medicines with her were a baby aspirin, Unisom sleep tabs, because I had horrible problems sleeping, which is actually very safe for pregnancy because, fun little fact, Unisom sleep tabs was originally made as a nausea medicine for pregnant women until they realized how tired it made them, and then that's when it turned into a sleeping med.
Fun fact.
Yeah. Metformin, 500 milligrams.
And that was not for diabetes, because metformin is your typical diabetic medication.
Actually, I am wrong. That is not with this baby. That was not with Nevaeh. That was only with this one. And I'll get to that part, but promethazine for nausea, and methyl dopa for my blood pressure. And then the Lovenox shot. Once I did get pregnant, they put me on those, and I had to get on them right away because that's what prevented all the blood clots from happening because of the blood disorder.
Right. So the biggest thing with our pregnancies is the goal is to keep our folate and our pregnancy hormones and levels at a normal level, but then also to keep our blood thin enough to sustain a good pregnancy. You want that good blood flow to go from the placenta through the umbilical cord to the baby. So that was the goal of what the doctors were setting. And then once Courtney was done with that doctor, you guys moved.
Yes, my husband got medically discharged from the military, and so we moved home. Right, Nevaeh was probably 6 months old. And then
the biggest thing
that was when my struggles truly really started.
Yeah.
Because then at that point I knew I could have a healthy pregnancy and I could have a completely healthy child, but
it was getting a doctor on board.
I was only a guinea pig, a trial in that study. So everywhere that I took, even though I could show them this perfectly healthy baby, no one wanted to give me blood thinners because
all of them were completely against it.
All of them. I mean, it was just a nightmare. No one and every doctor. I had
to basically beg my doctor to put me on baby aspirin. But I would have taken it anyways just because just from hers. Now, just kind of a little bit back to my side of it. I got tested for this disorder because Courtney was tested and it showed that she had it. So before children were even a thought in my husband and I's mind, Courtney suggested that I go and get tested so that prior to us starting to try to have a family, I would know this in the back of my mind to help prevent miscarriages. And I'll tell you what, it was a huge struggle for me to find a hematologist that was on
that
board.
Would listen. They don't want to listen.
Because the biggest thing with MTHFR is your homocysteine levels. That is the thing that they are looking at the most. And when you're not pregnant, our levels are normal. Mm-hmm. They're normal. So when you go to a hematologist and they take all your vials of blood, it shows that you have the mutation, but it also shows all of your other levels the same. And the hematologist that I went to, his exact words to me, this was pre-baby, he said, you have to have a miscarriage before I will ever treat you for anything.
And
he wanted me to endure a miscarriage before I was even a thought for him to put me on any of that medication regimen.
Regardless
of her history.
My history, and not only just my history, but once I was diagnosed with all of this, my dad had surgery and then was put on Lovenox.
My dad had Crohn's, he had a lot of GI issues, and he was in for an abdominal surgery.
Yes.
And I think they tested him prior to giving him.
And my stepmom just kind of put 2 and 2 together and then asked the doctor, this is what...
Right.
I have to go to the bathroom.
Okay. All right, guys. Warren had a little potty break, so we're back for more. So we are going to get back on the topic of our dad as well. So he went in for, he has Crohn's, or had, I should say. If you've watched my channel, you know, unfortunately, he did pass away 5 years ago in May.
It hasn't been that long.
I think it's been 5 years ago in May. So I'm going to let Courtney talk about kind of our dad's history and how it relates to us as well.
Well, my dad had surgery, and that was what he got put on, the Lovenox blood thinners to prevent blood clots with the surgery. My stepmom decided that to ask the doctor about it and tell them about my miscarriages and stuff, and that I was put on the Lovenox, and realized that it was all kind of connected. Then that's when we started doing even more research and found out
And even
that
more testing.
yeah, and that's how we found out that it's hereditary.
Right.
So my dad had, I think, his
Factor
12.
Factor 12.
I'm pretty sure. And so, I guess the unique thing you would say with blood disorders, they're hereditary, but just the fact that what's hereditary about it is that you get a blood disorder, not necessarily the same blood disorder. So,
Right.
like my dad has the factor 12, but we have the MTHFR,
Right.
and then
So it's a form of a blood disorder, not the exact.
it's just blood disorders in general.
Right.
That is the hereditary part. But then I also found out after Nevaeh that I had polycystic ovarian syndrome, which with that, what is difficult is, so I had all the problems of carrying one, and I never used to have problems getting pregnant.
Mm-hmm.
Well, now on top of that, another strike on my card would be that now it was hard for me to even get pregnant. On a triple dose of Clomid, I wasn't ovulating. So that was where my metformin came into play. Around when I was just reading stuff online when I realized that the normal stuff that they give women to help them ovulate is the Clomid. That's the pretty common one, I think.
Mm-hmm.
And when I realized it wasn't working, I was just so determined to find something that did, because I knew I could have a healthy baby.
Right.
That's when I found out that I did not have diabetes. I was not diagnosed with diabetes, but I had read through studies that women of childbearing age that were diagnosed with diabetes that could not get pregnant in the past, no matter what they did, was getting put on metformin to assist with their diabetes, and then a couple months later they were ending up pregnant. So that's when they correlated the two together, that metformin was helping women of childbearing age.
See, I'm
get
learning
pregnant.
a bunch of stuff too.
And so I went into the doctor's office at that point and was like, it's a shot in the dark, but I want to try it, because now women with diabetes that had polycystic ovarian syndrome, not just women with diabetes, but women that also had my PCOS. So I tried that, and I've been on metformin ever since. And now, actually during this pregnancy, I have had blood sugar issues, and me being on the metformin has actually stopped me from having to have insulin.
Now, on the flip side of that, during my pregnancy, I was gestational diabetic for both of my pregnancies, and because I didn't have that metformin on top of my medications, I was insulin dependent for both.
And I probably would have, and the last couple of weeks, they actually, past 3 or 4 weeks, they went back and forth about putting me on insulin, but I just tried to control it with my diet instead of, which is the exact opposite with her. It didn't matter what she ate.
It did not matter what I ate. Basically, to wrap it up, because it's getting pretty long. So on the bottom line of it all is that our MTHFR disorder has been the leading cause of most of our miscarriages. Yes. So, and like I said, I've had 4 pregnancies, 2 live births. She's had 10 with 1 live birth and another live birth this coming Wednesday. And the biggest part about my losses that I had was my first miscarriage that I had just found out that I was pregnant. So I just had the positive test on my positive pregnancy test, and I made it to 6 weeks, I think, with my first miscarriage. But I feel my body did not have all of the extra stuff that I needed to sustain that pregnancy. With my second miscarriage that I had, I went in for everything was great, growing perfectly, and I went in for my 10-week ultrasound, which we go to a different ultrasound place that kind of treats us very, very special. Ultrasona in Columbus, Ohio. We love you very, very much.
Very much.
And you are near and dear to our hearts. But we would go there multiple times to check on our pregnancies, and they would check the blood flow to make sure, kind of peace of mind for us, to make sure everything was good. Now, I went in for my 10-week ultrasound, and the baby had stopped growing with my third pregnancy at 8 weeks. I want to say it was like 8 weeks 3 days or 8 weeks 4 days. It showed that I had vanishing twin syndrome with that pregnancy. I think it was that one. So basically, bottom line, we're weird. We're weird.
Pretty much.
We're weird, but if you find, ladies, fight for yourself. You need to find a doctor that will take care of you.
And it is very, very, very frustrating. I know firsthand. I've seen every single doctor, and it's horrible. Like, I finally found one that would listen to me, Dr. Folk, great doctor. And I just found one that finally listened to me. So I finally got what I needed, and because I got the shots, I have a healthy pregnancy.
And I'll tell you what, it's been rough.
Very.
It's been so hard. And obviously a lot harder for Courtney in everything that she has been through. I mean, think of how traumatic, just for your body and healing alone, to go through that many pregnancies and miscarriages. But once you find someone who will listen to you and take you seriously and understand that this disorder is a problem,
and you have to advocate for yourself and be knowledgeable about your disorder and what can help you,
right?
Because if it wasn't for me being adamant about, this is what I've even been adamant about, I want to be tested for this specifically or that specifically.
You have to make sure to speak up for yourself, because if you don't, they're not going to take you seriously. Unfortunately, women will have miscarriages after miscarriage,
and they're just told what I was told over and over again. It just wasn't meant to be. This is God's way of saying that it wasn't a healthy baby, and it's just not meant to be.
And that it was something was off in the pregnancy, and you wouldn't have made it full term. She's heard that how many times?
I've heard so many. And by the time I heard it to a certain extent, I'm like, okay, well, that's when I started advocating for myself and found out all of this, and then just. The research online is, you're going to find a lot of stuff that is not true. You have to be able to decipher what is and what is not. Right. But,
Take it from the clinical scientific proof, the research that is out there. Like the doctor that she went to in Kentucky, who, he spent all of his time researching that and took Courtney in and helped her, and that's where she gained the majority of her knowledge to be able to be successful and to tell these other doctors when she moved back here, listen, this is what works. You need to do this, this, and this.
And they did exactly what he told me they would do. They thought I was crazy.
Yeah. So advocate for yourself is what we're saying. Bottom line, the biggest thing that you guys need to take away from this video, if you test positive for this gene, no matter what mutation, you guys need to stay on top of the medications that you're asking for. If you have a doctor that is not familiar with this disorder, go to a high-risk doctor. See if that doctor will refer you to a high-risk doctor who is more knowledgeable about it. Advocate for yourself.
I have my regular OB, but then I correlate with a high-risk OB.
Right.
So that is how my care has gone this time. And they do consider me high risk. And that's been the other very, very hard thing for me to be able to get. It's been until, I mean, it was what, how many miscarriages was I in before they even would consider me high risk?
Right. So Nevaeh was Courtney's 4th pregnancy. So
Probably
this is her 10th.
Like my 7th before they considered me. I had to be on the metformin, and once they saw the metformin, all doctors, as soon as they see metformin, they automatically think you're diabetic.
And that's not the case.
But it was actually a good thing for me, because as soon as they saw it, diabetics during pregnancy get a lot more attention than what a normal pregnancy does, and that I feel like has really helped me get to where I am with this pregnancy.
Right. And so also to wrap it up again, back to my pregnancies, both of my pregnancies that I had live births with, so Grayson and Warren, I had a handful of things besides that were complications with my pregnancy. So with Grayson, I was gestational diabetic, and I had complete placenta previa. I had complete placenta previa with both of my pregnancies. So for the majority of my pregnancies in the beginning, I was on modified bed rest. And then once my uterus grew, the way that they told me to visualize it is if you have a balloon and you put the placenta on the very bottom of the balloon, then when you blow it up, it gradually will move off of your cervix. Now some women it doesn't, but that's how in my case, thankfully they moved enough to where I was able to have both vaginal births. But I had that, I was gestational diabetic, and then with Grayson, she also had a shoulder dystocia during her delivery. So another thing with my deliveries was that, now Courtney was a C-section, so hers...
After like 27 hours of labor.
Right. But when it came to mine, when I went into labor on my own with my daughter, and they told me because my platelet levels were low, more than likely due to our blood disorder, I was not able to have an epidural.
I was also told I couldn't have an epidural, but that was 5 minutes too late because they had already given me one. So, so your whole, if you ladies out there, to the ones who have had natural vaginal births, you feel me. You know exactly what I'm talking about. But regardless of the type of delivery and birth that you have, women are so powerful. All right, guys, so we are going to wrap it up. Please make sure that you like and subscribe to our channel, and down there below, make sure you hit that bell to be notified when new videos are posted. And if you have any questions for us, we are really knowledgeable about all of this, so put them down in the comments, and if we need to make a second video, we'll make a
part 2, part 3. We'll keep going if we have to.
Answer all the questions that you guys have.
Yes, for sure. So thank you guys for having my sister on the channel. And
she wants to show off my baby.
Yeah, we're going to show off her baby bump. So this is her, how many weeks?
36. I'm 37 on Tuesday.
Yep. So she's going to show you her... That's her baby belly, and then...
I don't know if you can see from the shots, actually, from the Lovenox. I had some bruises.
Yeah. See,
it does cause bruising.
This is the bruising from her Lovenox injections.
These are actually quite beautiful compared to the ones I had with Nevaeh. But it's worth it in the end.
It's worth it. So, like we've said about 100 times, advocate for yourself, and we will see you guys in our next videos. So,
bye.
See you later, guys.